There's a lot of focus on the benefits of low-carb and ketogenic diets for weight loss, and specifically healthy weight loss. But that's not their only power, so to speak. People find benefits from low-carb and ketogenic diets in many different areas of their lives, a lot of which can focus on sort of the brain or neurological conditions, whether that's headaches or whether that's mood disorders or mental health benefits. This is one of those areas where having a higher fat version of a ketogenic diet and possibly even following ketones and trying to push blood ketone levels higher may be beneficial. You've probably heard us say time and time again that for overall health and weight loss, there's no clear evidence that higher fat levels or higher ketone levels are better than lower ones when it comes to a low-carb diet. But in this setting, things might be different. I'm Dr. Brett Scher, the medical director at DietDoctor.com, and I want to talk about the benefits of a higher fat version of a ketogenic diet, specifically for neurological health. And we have a couple guides about this at DietDoctor.com. The first one I want to talk about is for headaches. If you suffer from migraines or cluster headaches, you know that there are few things in life that can just drop you to the floor and ruin your day as much as these headaches can. Treatment is, it's improving all the time with new medications and also knowing the lifestyle factors that can trigger headaches and what to avoid, making sure you get adequate sleep and not too much caffeine and lots of other things. If you suffer from migraines, you likely know that. But did you know a ketogenic diet also might be beneficial at preventing or decreasing the frequency of migraine headaches? Now, we have to be honest, the evidence isn't robust in this area, but there's this one group in Italy who's been studying this quite a bit that we highlight in our guide at our website, dietdoctor.com. And it's interesting, they started with a case study in two twins, one doing ketogenic diet, one not. Then they went to an observational study in 96 individuals. Those who were following a ketogenic diet had fewer migraines than those who weren't. And finally, they went to a randomized crossover trial in 35 individuals. And those who were following the ketogenic diet had a 50% reduction in the frequency of their migraines, whereas those who were not on a ketogenic diet really had no significant change in their migraines. So again, it's not overwhelming evidence, but it certainly suggested that there's something about a ketogenic diet that is beneficial for the brain and for migraines. And we know it works for epilepsy. It's been 100 years or so that people have been using it for epilepsy. The thought being by offering an alternative fuel source, that ketones being an alternative fuel source for the brain, and also with a ketogenic diet and ketone levels sort of reducing inflammation, possibly helping with chemical imbalance. A little bit of a theory there, but maybe that's why it works for epilepsy. Well, the same can be true for migraine headaches. Could be the same mechanism. So does that mean if you go on a keto diet, you're automatically going to cure your migraines? No, of course not. But does it mean it might be a better chance for you to reduce your migraine frequency? Possibly. It certainly could, and may be worth a try. But as with any use of a ketogenic diet specifically to treat a medical condition, we recommend you work with an experienced clinician. And you can certainly find experienced clinicians on our website, on our Find a Doctor map. Hopefully you'll be able to find somebody in your area who can work with you or someone who does telemedicine consults to help see if maybe a ketogenic diet is the right move for you to help with your migraine or cluster headache frequency. But the other thing beyond headaches is mood disorders and mental health disorders. And we have a guide on this as well at dietdoctor.com written by Georgia Eade, a psychiatrist who really is sort of revolutionizing the food as medicine, the food as mental health movement. And in her guide, she talks about anxiety, depression, bipolar disorder, psychosis, autism, ADHD, even Alzheimer's and eating disorder, and how a low-carb or keto diet has shown some efficacy in these various mental health disorders. Now, again, it's not overwhelming, robust data showing that a ketogenic diet is better than all other approaches, but there's evidence showing that a ketogenic diet certainly is an effective approach and maybe one that you want to consider. And we go through all the evidence in our guide. But the point being that things like mental health and headaches and neurological conditions, those are areas where higher fat likely has added benefit. So at Diet Doctor, we've been really big lately on considering raising your protein level. Having a higher protein lower fat, although not low fat, maybe 60% fat instead of 75 or 80% fat diet, with the 30% protein diets, around those ranges, moving in that direction if you're stalled on weight loss and metabolic health and body composition. But one area where you might not want to consider that is if you're looking to improve your mental health or your headaches or other neurological conditions. That's where you want to work with a low-carb friendly clinician to see if the higher fat, low-carb ketogenic diet is right for you. So hopefully this helped put things into perspective, and you can click on the guides, links to the guides down below to take you to the full guides. You can see all the evidence. I mean, they're pretty detailed with all the studies and the different evidence. This is just sort of an overview of all that. And if you find this helpful, please click the like and subscribe button down below and leave a comment. And that way you'll get all our updates for future Diet Doctor news here on YouTube. Thanks a lot, everybody.